mostly beneficial. However, it's difficult for a patient without medical knowledge to competently evaluate a qualification of that service provider, the skills of that service provider, the knowledge and competency of that service provider, before they can entrust their care in the hands of this practitioner. And the state, therefore, is expected to make sure that the patients are protected against healthcare practitioners. And one of the most common way of doing it is actually to regulate how these practitioners do their work. And the rationale for professional regulation, especially in health, therefore, is patient safety. Nothing else. Is patient safety, which refers to a state of freedom from accidental or preventative harm in healthcare settings caused by healthcare professionals. Now, there are different approaches where you regulate this. One mode could be self-regulation. The others, it could be the state itself that actually doing this work. Sometimes it can also be professionals on themselves without involving the state. So if you go to several jurisdictions, you find these models. But the focus of my talk today is about professional self-regulation, because that's the approach that Namibia uses to regulate healthcare professionals. Now, history has it that this model of professional self-regulation did not originate from medicine or health services. It actually originated from sociologists. Somewhere during the golden age in the 20th century. And it's actually based on understanding that those of us who acquire this specialized knowledge may have a propensity of using that knowledge to the detriment of those who do not know what we were trained to do. That's the premises. And therefore, these people that learn how to do a lot of things that the public do not know somehow need to be regulated. Otherwise, and I want to be clear, that healthcare professionals don't wake up from their beds to go and harm patients. No, that's not the idea. But they are members of society. And there's no shortage of news in this country where you hear people. So we have characters among us that definitely need to be supervised and they need to be monitored so that they don't take obliviousness of the clients, to their own detriment. Now, cognizant of this danger, the state then decided to enter into an agreement with the professional groups to say, please regulate the behavior of your colleagues, of your members, for the benefit of the patient. And in exchange of this, we will take our hand off so that we don't keep on monitoring and bothering you as what you do. So that's the agreement. And that agreement normally takes a form of an act of parliament. And that's where the Health Professions Act, number 16 of 2024, come into picture. It's actually an agreement between the state, and I'm not referring to government, I'm referring to the state, because there's a difference between the two. So the state entering with the healthcare professionals to say, get these tools and go regulate yourself, and for the benefit of the patients, not your own benefit. And it's this act that actually provides the legal framework for the regulation of healthcare professionals in Namibia. It's this act that spells out the ambit of the legal authority delegated to the professional regulators, the HPCNA, and I will be using the HPCNA, the body that I represent, because that's the regulator. But the states still maintain some level of control over the practice of healthcare practitioners and the service